Today, we are diving deep into a really fascinating study that shows how people in rural Pakistan deal with something most of us dread, a truly severe toothache. And let me tell you, what this study found is a world of deep-seated beliefs, incredible barriers to care, and honestly, some shocking home remedies. Let's get right into it.
So I want to start with the number, just a number on a screen, 22.34%. What do you think that represents? We're talking about a study of over 1,600 people, all suffering from serious dental pain. What could over a fifth of them possibly be doing?
So the real question is, when that pain is just unbearable, where do they turn first? I guarantee you it's not what you're thinking. It's not a trip to the pharmacy, and it's definitely not a call to a clinic. And that brings us to our first and maybe the most startling finding from all of this research.
Yep, you heard that right. For almost a quarter of these patients, their go-to, their first line of defense, is a religious spell from a family priest. And what's really wild is that they reported it actually worked, that it gave them relief for anywhere from 2 to 6 months. Now, this isn't just a random statistic. It's a huge clue that there are some massive underlying issues keeping people from getting conventional care. So you have to ask, why is this the preferred option?
Well, to really get a handle on the cure, we first have to look at the cause. And according to this study, the problem starts way before the pain ever does. It starts with this huge gap in basic, daily, preventative care.
The findings on just basic oral hygiene are, wow, they're incredibly revealing. Get this, over 37% of the patients in the study use absolutely nothing to clean their teeth. Nothing. And you see that tiny little sliver over there? Yeah, that's brushing. Just over 5% use a toothbrush. Most people are relying on traditional methods like miswak, which is a cleansing twig, or musag, the dried bark of a walnut tree. And right here, this is the core of the disconnect. Almost 74% of people in the study know that not taking care of your teeth leads to problems. They get it. But only about 5% are using what we consider the standard tool for the job. So see, this isn't really a knowledge problem, it's an action problem. So what happens when this gap leads to that inevitable blinding pain?
This is where the story takes a much darker turn. When preventative care has totally failed and people are just desperate for any kind of relief, they turn to a really stunning and kind of scary array of self-care methods.
The study listed out the remedies people are using, and it really just paints a picture of pure desperation. It starts with things you might even recognize, like clove oil or salt water, but it escalates, and fast, to things like spirit, perfume, and then to the truly shocking, putting heroin into the tooth's cavity, or, and this is hard to even say, applying car battery acid directly to the tooth. The researchers make it really clear. These aren't choices people are making out of ignorance. These are acts of desperation to stop an overwhelming, all-consuming pain.
But see, these desperate measures, they're just symptoms. They're the end result of much bigger systemic problems that are blocking people from ever getting professional help. So now we're going to dig into that deeper why. Okay, here's another number for you. Just under 3%, 2.95. After everything we've just seen, what do you think this tiny little percentage could possibly represent?
That is the percentage of patients who actually went to see a dentist for their toothache. Fewer than 3 people out of every 100. So if they're not going to a dentist, where on earth are they going? And the answer is pretty surprising. While less than 3% see a dentist, over 22%, almost the exact same number, who use religious spells, go to a general physician. Think about that. They are nearly 8 times more likely to see a general doctor than a dentist. And the study points out a really critical issue here. These physicians often have very limited training in how to manage complex dental pain.
So why? Why is this happening? Well, the research is crystal clear on the root causes. It really boils down to this perfect storm of high poverty, which just makes professional care completely unaffordable, low literacy rates, which can make public health messaging really difficult, and just the simple geographic reality that professional dental clinics, they often just don't exist in these rural areas.
And beyond all the practical barriers, there are these really profound cultural ones. This quote from a patient in the study, it's just so powerful. It shows this sense of fatalism, a deep belief that their health problems are literally predetermined by a family curse. And when a belief is that strong, a simple message like, hey, just brush your teeth more, is going to fall on deaf ears. It's not going to work.
So, when you put all of these pieces together, the lack of basic prevention, the desperate and dangerous remedies, and these deep systemic and cultural barriers, we are left with one major challenge.
And that brings us to the final,
big question this research really leaves us with, and it's not an easy one. When the problem isn't just about a lack of information, but it's a complex web of poverty, access, and belief, how do you even begin to build a bridge to better care? It's a challenge that frankly goes way beyond dentistry. It asks us to think about how we create health systems that are not just available, but are actually accessible, affordable, and culturally in tune with the people they're meant to serve. And that's something for all of us, especially any future health professionals out there, to really, really think about.